Yeah.
Okay.
So when I started primary care, I worked for a large corporation. I did it for a year, and I was so not happy. I maybe had 10 minutes with a patient, if that. And if it went longer than that, I was going to be so far behind. It was so ungodly stressful. I was doing all my notes the night before, like chart prepping, so that way I could sit and talk to somebody and not feel like I was on a computer.
Yeah.
Um,
You not have that in the back of your head. Like, then how
no,
can you even be fully present with
you can't.
somebody?
You can't. I mean, and they have a lot of new technology now that they plug into their computer and it records you, and they use AI to try to do your notes, but you still got to review them. I mean, if you don't, then that's not a good practice.
Right.
But yeah, and I just said, this is not for me. I just cannot see myself not having that. You have direct patient care without having direct patient care,
Yeah.
and I can't do that for the rest of my life. I certainly also knew I was capable of doing a lot from a primary care perspective, that not that we were told not to do it, but it was like, someone's coming in for a shoulder injury. Send them to ortho. What are you doing? Why are you keeping them here? Why are you ordering an x-ray? They're going to go to ortho anyway. Like, no, they're not. They fell off their bike. As long as there's no fracture, I can do conservative therapy myself.
They're referring within the same corporation to get more money out of somebody's insurance?
Yeah, for sure. Yeah, there was a lot of pushback if we had like a patient who wanted to use an outside lab or an outside imaging facility. And it was, well, no, you need to stay within our group. Why? Well, it's just better for the provider, because then we have everything. We have access to everything. I'm like, we already have access to everything. There's something called HICSNY. It's the Health Information Exchange of
So if
New
somebody
York.
went somewhere else, you can log in, boom, and there it is.
It's there.
Right.